In the healthcare field, employees are the most important part of any safety program. You may come across unique and possibly fatal hazards every day. This program will show you how to protect yourself from some of the most common hazards. This program is not intended to give in-depth training about each subject, but to be a brief orientation to some possible safety hazards. Your employer will provide more in-depth training on those safety hazards that you might encounter on a more frequent basis. First, it is important that all employees keep alert to their surroundings for possible safety hazards. If you detect a safety hazard, then you should take immediate steps to correct the problem. This may include correcting the problem yourself or notifying your supervisor or other employees who can correct the problem. Now let's cover some basic safety concerns and how to prevent or correct them. You can reduce your risk of injury from slips, trips, and falls if you are aware of your surroundings. You should always look where you're walking, take short, slow steps, and maintain your center of balance. Be aware of these common fall hazards: wet or slippery floors, loose carpets, cords, poor lighting, and trash or debris. One of the most important steps to preventing slips, trips, and falls is to wear appropriate, comfortable shoes with good traction and support. This will not only prevent slips, but will also help your back. Now let's take a minute to talk about back safety. Many healthcare workers place significant strain on their backs each and every day. To avoid back injury, stay physically fit and maintain good posture. When lifting a patient or heavy item, bend your hips and knees, not your waist. Lift with your leg muscles, not your back or arm muscles. Avoid twisting. Never lift a load higher than your waist. Keep the load close to your body. If you need help lifting or moving a load, ask for it. Many healthcare facilities also provide mechanical devices to help lift patients or other heavy loads. Use them when needed. It's better to get help than to injure your back. The best method of fire safety is fire prevention. All employees should take basic steps to prevent fires. These steps include keeping your workplace free of trash or other combustible materials. Do not overload electrical circuits and replace damaged electrical cords. And do not allow sparks or flames in areas using oxygen or flammable gases. Not only should employees prevent fires, they should be prepared in case of a fire. Know the location of all emergency exits and fire alarms. Learn how and when to operate fire extinguishers. Remember, smoke and heat are just as deadly as flames. If you suspect there's a fire, don't touch or open any door without first testing the amount of heat radiating from it. Stay low to the floor to avoid inhaling too much smoke, and remember that others' lives may depend on your actions. To manage electricity safely, examine all cords and plugs routinely. Do not use damaged equipment and always report damaged equipment to your supervisor. Report all shocks immediately, even tingles. Never work around electricity when you or your surroundings are wet. Keep electrical cords away from heat and water. Don't run electrical cords across walkways, under rugs, or through doorways. Don't use damaged outlets or adapters that let you plug extra electrical cords into an outlet. Don't use any electrical device that blows a fuse, trips a circuit breaker, shocks, or appears damaged. And always follow the manufacturer's instructions when using electrical equipment. Healthcare facilities have many different types of hazardous substances, including cleaning chemicals, medications, and others. Your employer will train you on the specific types of substances that you may come in contact with, and additional information about these chemicals is located in your company's MSDS binder. This binder contains helpful information about every chemical in your workplace, including what happens when substances are mixed, how to dispose of hazardous substances, what first aid to give in an emergency. Make sure that you are familiar with the location of the MSDS binder in the event of an emergency. Personal protective equipment, or PPE, is a vital barrier between your body and possible health and safety hazards. PPE may include gowns, aprons, goggles, face shields, mouthpieces, CPR barriers, and most commonly, disposable single-use gloves. All disposable PPE should be properly discarded immediately after use. Any torn or punctured PPE should also be immediately discarded and replaced. When removing PPE, it is important not to contaminate your skin. When removing gloves, pull one glove off from the outside top and hold in the gloved hand. With exposed hand, peel the second glove down from the top, tucking the first glove inside the second. Don't use your bare skin to touch the outside of either glove. You should immediately wash your hands after removing your gloves. No barrier is 100% effective, so always wash thoroughly between each patient. This is for your health as well as for the health of the patients. OSHA requires your employer to develop an exposure control plan to help protect all employees from exposure to bloodborne diseases such as HIV, AIDS, and hepatitis B. As a general rule, employees should treat all medical waste and blood as if it were contaminated and take appropriate safety precautions. Don't eat, drink, smoke, apply cosmetics, or handle contact lenses in any area where there is a reasonable likelihood of contamination. Don't keep food or drink in refrigerators or other areas where blood or other potentially infectious materials are present. Minimize splashing, spraying, and splattering when performing procedures involving blood or other potentially infectious materials. Separate and label all medical waste at the source. Use separate containers for each type of waste. Remember that red or red-orange colored labels, bags, or containers with the biohazard symbol warn you that the contents are biohazardous materials. Needle sticks are one of the most common ways diseases are transmitted on the job. Do not bend, recap, shear, or break needles or other sharps. Immediately after use, place sharps in an appropriate puncture-resistant, leak-proof, color-coded container. Blood and other bodily fluids can carry viruses, bacteria, drug-resistant organisms, and radioactive waste. Therefore, it's important that all medical waste related to patient care be treated as potentially hazardous. All laundry or waste should be handled with minimal agitation and disposed of in the appropriate containers. Good housekeeping is a very important part of workplace safety. It's your responsibility to keep your work area clean. Your facility's exposure control plan lists specific methods and schedules for cleaning surfaces that may become contaminated. Here are some general rules. Protective coverings on equipment and surfaces must be replaced if contaminated or at the end of the work shift. And all non-disposable surfaces must be properly disinfected or sterilized in accordance with your facility's cleaning procedures. These are just a few of the items to help you keep yourself and your workplace safe and free from hazards. Your employer will most likely have more in-depth training for your specific needs.